We will briefly describe the empty can test. There's also a full can test, which we can use to assess supraspinatus tendon injury. We'll also identify the function of the supraspinatus muscle in initiating arm abduction at 0 degrees and abducting the arm up to 15 degrees. And we will identify the suprascapular nerve as the one responsible for innervating this supraspinatus muscle. So skeletal muscles have tendons which are made of type 1 collagen to attach them to bones. By the way, the collagen that we need to know in bone is also type 1. The supraspinatus muscle has a tendon, and that's the one we're talking about now. Real quick, why is it called supraspinatus? The shoulder blade, which we can also call the scapula, has a little ridge or spine going across it. Superior to this is where the supraspinatus muscle sits. There's also a different muscle that sits under that is inferior to this same spine. So this other muscle is called the infraspinatus. Supraspinatus and infraspinatus are two of the four muscles that comprise the rotator cuff. An injury to the supraspinatus is the most common rotator cuff injury. On physical exam, we use a test called the empty can test to assess supraspinatus tendon injury. The doctor stabilizes the shoulder and, asking the patient to resist it, applies a downwardly directed force at the elbow or wrist. We call it a positive test if the patient experiences pain and/or weakness with resistance. Supraspinatus function is abduction from 0 to 15 degrees. You know abduction is, in a sense, leading the arm laterally away from the side of the body. We like to pronounce abduction funny, so in a noisy room it sounds distinct from adduction. So if you want this to work, you have to not pronounce adduction funny. If you pronounce them both funny, it doesn't work anymore. It would be like someone saying, "I would like some CBD. C is in cat, B is in bat, D is in dat." It's not helpful if they sound similar. So we like to say adduction and then contrast that with the very different sounding abduction. When the supraspinatus gets the arm to 15 degrees, the deltoid takes over to get up to 90 degrees. So that's how you're working the shoulders at the gym with lateral shoulder flies. Do you lift, bro? Interestingly, the two muscles you have to know that do adduction are the teres minor muscle and the subscapularis muscle. Here they are on the diagram we were looking at before. So those are actually the other two muscles of the rotator cuff. I just want to note that the subscapularis muscle is so named because it is under the scapula, under in the sense of deep to the scapula. Innervation of the supraspinatus muscle is via a nerve we call the suprascapular nerve. Since the subscapularis muscle was under in the sense of deep to the scapula, the suprascapular nerve is over in the sense of superficial to the scapula. It innervates the supraspinatus muscle, which again sits superior to the spine, and actually also innervates the infraspinatus muscle, which again sits inferior to the spine. Finally, in terms of roots of the brachial plexus, innervation of the rotator cuff muscles is primarily by C5 and C6. Here's a quick look at the brachial plexus one more time. Okay, let's tie it all up. The infraspinatus muscle is on the outside of the scapula, inferior to the scapular spine. Also on the outside, but superior to the spine, is the supraspinatus muscle, and both are innervated by the suprascapular nerve. The supraspinatus and infraspinatus are two of the four muscles that comprise the rotator cuff. The other two rotator cuff muscles are the teres minor and the subscapularis. Innervation of the rotator cuff muscles is primarily by C5 and C6, and both the teres minor and the subscapularis are needed for arm adduction. The supraspinatus serves to abduct the arm from 0 to 15 degrees. From 15 to 90 degrees, it will be the deltoid that performs abduction. Injury to the tendon of the supraspinatus is the most common rotator cuff injury and is assessed using the empty can test. Okay, that's it for this one.